So when you present the same 2 minutes, do the students be like, how do they respond? Are they like, okay, we just saw this, what is she doing? Because my guess is they're used to sitting and watching the full 40-minute session or whatever. So what kind of reaction do you get from them?
I think initially people are wanting to move on. However, once we do it a couple times, they start seeing things that they never saw. You know, I've had students that I've shown a video before, and they've like, oh, I've seen that video before. So we watch the 2 minutes, and they keep coming up with new things after new things after new things. And they get really excited. So instead of getting bored with it, they actually get really excited, and they think, wow, I had no idea that watching 2 minutes of tape, I would get all of this information.
Yeah.
And notice things that I've never noticed before. And then some will, later on in the semester, will even, you know, let me know that they've been thinking about this thing that they noticed in that 2 minutes, and that's affected their clinical work. Or even their interpersonal interactions with their family members. I mean, it's really amazing the impact that the methodology has.
So would there be some areas that this methodology is particularly well suited for, in your opinion, or other areas where it may not fit so well?
I mean, I'm probably biased because I've done the work, but
maybe.
I think it's one of those methodologies that you can use in any setting, any clinical setting, any type of interpersonal communication setting. As long as you have two people interacting and you're able to observe both people, you can use this type of methodology. They use it, Janet uses this with medical doctors, physicians delivering bad news to patients, ways in which they do it that's more successful than others. So in terms of field, I think it can apply to any field where communication is present, which is pretty much anything.
Yeah, anything. Now, I hear you talking a lot about dyads. Is there thought about when there's more than just that relationship in the room? Obviously, in our therapeutic world, there'd be the dyad if we're working with a couple, and then the therapist. And of course, you have more than just that one relationship there. But then what if you had a family of 5 or 6 people in there?
That's a great question. We have not tried that yet. However,
so that area would be ripe?
Yes, that's a new area if anybody's interested. We have some videotapes of DV groups done at Ohio State. I have a colleague there. She has videotapes as well as outcome data for those videotapes, and we are going to start a project. I'm going to start with Adam, and we are going to start to look at pairing those, which is ultimately what we're all really interested in.
So to take the process data that you generate through your coding and analysis, I don't want to say coding, right?
Analysis.
Your analysis. So take that process data and hook it to the outcome data.
Exactly. Okay. And these are going to be groups. And so we have no idea how we're going to analyze therapists and clients in a group setting because we've only been analyzing one client and a therapist. So there's a whole new area to explore. Because it's inductive, as long as we can figure out a way to do it and others can replicate it and have good reliability, then it can be done. So it's just figuring out how to do it, which is the fun part, I think.
Yeah.
So.
Okay. Well, you may get calls from a lot of people as a result of this interview. So
that would be wonderful.
All right. It's great to sit with you today and to hear you talk about this, and I'm excited for you, and I know you're doing great things. So. Thanks for your time.
Thank you much, Steve.
All right.